Now to new research that says abdominal fat may be a better predictor of your heart disease risk than your BMI or your body mass index alone. BMI is the number that's commonly used to assess if you're at a healthy weight, but this new study says it could be missing key information. ABC News medical correspondent Dr. Darien Sutton is here to tell us all about it. Dr. Sutton, is this surprising? I feel like we've always heard BMI, 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 and now it's saying that might not be the number we need to look at.
You know, not necessarily surprising, but confirming what many nutritionalists and weight specialists have been talking about, which is that there are more factors that we should consider when we're talking about weight. And what this study suggests is that how you carry your weight or where you hold your weight might tell us something important that looking at your BMI might not or might be able or might unfortunately miss. So this study is actually from the journal of the American College of Cardiology, and researchers followed more than 250,000 people for about 20 years. And they looked at their BMI, their waist circumference, as well as their waist to hip ratio. And what was striking about this study is that for adults, regardless of their BMI, for all adults who had a high or what's considered a high waist circumference, that was associated with outcomes like heart attacks, strokes, heart failure, as well as atrial fibrillation, which is an abnormal heart rhythm. Now, important to note, I see all of these complications in the emergency room, and I think it's so important because BMI is not the only risk factor, but we often associate it to that.
Right.
About 20% of people in this study with a normal BMI, or what's considered normal, had a high waist circumference, and those are people that BMI alone would not identify.
One other thing that's interesting about this study is you can actually check for this at home yourself.
Yeah.
How do you go about doing that?
Really simple. I grabbed this tape measure from my house, and it's something that I don't often use because, gosh, is it frustrating sometimes to try to do it
in the toolbox.
I measured myself, and I was a little bit too close for comfort. But what you can do simply is you put your hands on your hips. You feel your hip bones, and you're going to measure your waist. It's right above that area. And
Right above
your
the hip
hip
bone.
bone.
Right above your hip
Yeah.
bone. So what's
Okay.
considered high in this study for women is 35 inches or more. What's considered high in this study for men is 40 inches or more. The next step you're going to measure is your hips, and that's just the widest part of your hip region. And you're going to take your waist measurement, divide it by your hip measurement. Sorry, I'm doing math this early in the morning. For women, a number over 0.85 is considered high. For men, a number over 0.90 is considered high. Now, these are important numbers that you can understand at home by just simply taking your measurements.
Okay, so we'll be doing that math. So let's say someone takes these measurements, they do it, they find that that measurement is a little high.
Yes.
What do you do with that?
No need to panic, and this is coming from a personal space. It's just one note or one indicator of your overall health. So when you take that measurement, write it down and use it as a factor in understanding your overall health, and then you're going to do a quick self-assessment. If you're finding that you're reaching those what's considered high numbers, you're going to ask yourself, are you getting the fundamentals? Are you getting enough sleep, 7 to 9 hours a night? I'm speaking to all three of you, and I know
Thanks for that.
You know the answer.
and that's why I started with it. Are you getting enough important diet, heart-healthy diet, minimizing processed and ultra-processed foods? And are you getting physical activity? And if you're not able to reach your goals by even trying that at home by yourself, understand that these are systems and problems that you should bring to your doctor because it's just like high blood pressure or cholesterol. If you can't reach your goals by yourself, that's where medicine comes into play.
And what other metrics besides these
Yeah.
can people monitor at home to reduce their risk of cardiovascular problems?
You know, so aside from taking track of your basic fundamentals, talking to your doctor about your blood pressure, your cholesterol, and your blood sugar, those are the main factors that help you understand your cardiovascular risk so that you can know which direction to go in next.
All right, important
All right.
stuff.
Very
Thank you.
important. Thank
so
you so
much.
Of course, of course.